breast cancer is quite prevalent. It is the most prevalent cancer among women. And because it's the most prevalent cancer among women, it also contributes to the highest death rate for cancers among women. So this is very important, I think, for people to note. We can change this outcome if we are able to make the diagnosis of breast cancer earlier. And that is why this month has basically been designated to focus people's attention on some of the things that they can do to identify or to discover very early if you have breast cancer. And but it's not only in October. I think for persons, they need to check, they need to be aware and use the whole year to try to make sure that they look after their health. For most people, I think what we would advise them to do, most women that is to do some amount of self-examination of the breast. They would be able to identify whether there are changes. One of the common things to look for is to see whether or not there's an abnormal lump in the breast. Some people can identify changes in the skin, so you can see dimpling of the skin in a particular area. Some persons might notice that one breast is perhaps bigger than the other. In other instances, the nipple itself can be retracted. So these are all signs that persons can look for when they do that breast self-examination. Another thing that one can do is also to check in the axillary region, that's under your armpit, to see whether you have enlargement of the lymph nodes. So these are all telltale signs. Now, if you do a breast examination and you think there's anything that is abnormal, then it would be important that you come and see your doctor and explain to them what you think you have found. In some instances, it might be nothing, but I guess it's best to err on the side of caution. We have, in Guyana, we have put in, for example, a mammogram machine at the Georgetown Public Hospital. So anyone who would like to get a mammogram done can come to the hospital and get that done free of cost. We are currently in discussions with the International Atomic Energy Agency. We have an MOU with them, and they have promised to donate to Guyana 3 mammograms. So we are currently in the process of looking at 3 of our regional hospitals, identifying the areas where we are going to be putting these mammograms, and then once they send the machines in, we'll be able to install it and to expand the services to offer more access to mammograms across the country. So that's one step that we're taking. And of course, with the set of infrastructure that we're putting in, we want to make these types of tests more accessible to people. So with the new hospitals and so forth that we're working on, in a couple of years, mammograms would become more accessible. Now, one of the big challenges that we have is when we do the fine needle biopsy, or when we do any biopsy for that matter, our pathology labs can take sometimes a long time. So just to prepare and examine the slides sometimes can be between 6 weeks to 6 months in some cases. And that's a very long time for somebody to wait to determine whether or not they have a cancerous growth. And so we have been talking to Mount Sinai about how to expedite this process. And one of the the methods that we are looking at is to add what is called telepathology. So we can prepare the slides here in Guyana. We'll be able to take a high resolution image of the slide, and then the oncologists in some other part of the world would be able to read the slide, pretty much like how you read a CT scan, and then be able to give a diagnosis. So we are working on a project like that where we'll be doing telepathology, and once we put that in, the turnaround time for diagnosis would improve very quickly. So instead of waiting weeks or months, that can come down to days, and which is going to impact on people who want to know their diagnosis more quickly. Another area that we're working on is to make sure that persons who have been diagnosed and require medication, there are certain medication that they will require. These medications are usually very expensive. Some people cannot afford it, and therefore we are trying to make these medications more accessible to patients when they need it, and for it to be in constant supply so that they don't have shortages of these medications. So that's another area that we have been working on, and I think we've gotten much better in providing these meds to the patients that need them. In the more medium term, we are working with Mount Sinai to develop an oncology center here, and it's not just for breast cancer, but it would be for all cancers. So we'll be able to have better guidelines in place for each of the different types of cancers, and to have not just meds available, but if people need chemotherapy or radiotherapy, all of those types of interventions would be available to the patients. So in the next few years, our oncology services are going to improve tremendously. But while we work on improving it, there are these baby steps that we can take by increasing access to mammograms and so forth. Now, the easier thing for us to do is to provide these services, but we also have to get people to utilize the services, and that is why this awareness month is so important, so that women who believe they have an abnormal lump, or they think they need to come in and see their doctor, then they should do that. They shouldn't wait. It's better to come in, talk to someone, and then take the next steps if that is necessary. We are recommending that people with any one of the non-communicable diseases, which is really a risk factor for hospitalization, that they should get the COVID vaccinations. So you have, for most people now, they should be getting their booster doses, and that's something that we're recommending. We have seen that with non-communicable diseases that people would be at a higher risk, and if you want to prevent them from being hospitalized, the easiest way of doing that is to make sure that they get their booster shot, that their immune system is prime, and therefore they can fight off the COVID-19 infection. So it is advisable that they take the vaccines that are available.